Dr. McCullough, any idea how many doctors don't even report adverse reactions to the VAERS database? Because the VAERS database is voluntary, and it's relying on doctors to submit this information. At least it's voluntary for patients. But, I mean, do doctors have any obligation to submit these adverse reactions?
You know, the doctors, would fill out a VAERS report if they think the vaccine caused the problem. It takes about half an hour to do a report, multiple screens. The doctor has to enter in all of his or her information, clinic information, the patient's email, the patient's phone number, the patient's vaccine card information. And it's all done under threat of imprisonment or federal fines if it's falsified. So people are pretty scared to report to VAERS. And so therefore, VAERS represents just a tip of the iceberg of what's happened. The most conservative estimate that's in FDA testimony is that it's underreported on death 30-1, meaning whatever's in VAERS in terms of death, it's 30 times greater. I mean, this is very important. So let's just get this. If right now the number of deaths reported to VAERS by doctors who think the vaccine caused death for COVID is 16,903. That's the current number through February 10th. That means multiply that times 30 to get to the number of people who've died of the vaccine. You know, it's well in excess of 450,000 people.
Wow. And that's just in the U.S., correct?
Those are U.S. domestic data, again, in VAERS. And it's consistent with the reports now for 2021, where that's centering up at 250,000 deaths. And for 2022, it's probably the same amount. Now, the CDC can clear this up in a heartbeat. The CDC should merge the vaccine administration data with the National Death Index so we know who died after the vaccine, who died on the very first day they took it, the second day, et cetera. And I've been pushing everyone to just push our government to tell us, because they can merge these two data sets. It doesn't have to be a mystery.